Today this video is about understanding optic disc edema. Now what is optic disc edema? This is a situation or a cross section which is showed of optic nerve where you have optic nerve sheath which is connected to the CSF space, and normally this space is unoccupied, so disc appears normal. However, when there is increased pressure, as you can see here, these spaces are dilated, and this space which is dilated has pressure over the optic nerve, which causes edema which is visible on the fundus. What does an optic disc edema look like? Now, this is a photograph of a normal fundus which shows a normal disc which has a sharp border, and we can see there are blood vessels which are emerging from the cup and they travel to the periphery. However, when you have optic disc edema, the disc margins appear blurred, the vascular signs are there, and there are ischemia signs, and this whole structure gets protruded inside the vitreous cavity, and so it appears like a raised mushroom or a head which is protruding into the ocular cavity. Now we will understand the signs which are seen by seeing the grading, and so that we can learn both the things simultaneously. Grade 1 is grayish C-shaped halo surrounding the disc, and the nasal side is spared. It involves primarily the temporal side, and there's some rising of the optic disc margin. It spares the temporal disc margins, and there are radial nerve fiber striations, and the disc margin is blurred. And this is grade 1. As you progress to grade 2, the halo becomes circumferential, that is, there's involvement of the nasal border as well, and there is no obscuration of any major blood vessel. As you progress to grade 3, we can see that there is obscuration of at least one blood vessel as indicated in this photograph, and there is elevation of all the borders of the disc as seen in grade 2 also, and the circumferential halo is persistent. As the stage progresses to grade 4, there is obscuration of at least one major blood vessel, and the mushrooming increases, and the optic disc cup which was occluded or obstruted is already there. As you progress to grade 5, there are signs of ischemia. There's hemorrhage over the disc margin, obscuration of all blood vessels on the disc, and all the features of previous stages are already there. Thank you.